This short video is designed to help you to understand what is involved in having a kidney transplant. You should watch the video and then read this short booklet which you will have been sent with your appointment for clinic, and then if you have any questions you can write them down and we will answer them for you when you meet us in the transplant clinic.
Hello, my name's Veronica Lennon, Transplant Manager, and I look forward to meeting you in the future.
Hello, I'm Sue Cook. I'm one of the Regional Transplant Coordinators. I look forward to meeting you.
Hello, my name's Carol Clayton. I'm a transplant practitioner on the renal unit. Look forward to meeting you.
Hello, my name's Michael Hope. I'm one of the 4 Regional Transplant Coordinators and I look forward to meeting you soon.
Hello, my name is Caroline Balance, the living donor and renal recipient transplant coordinator. I look forward to meeting you in the future.
Hello, I'm Mr. Andrew Raftery, Consultant Transplant Surgeon at the Sheffield Kidney Institute, and I look forward to meeting you in clinic.
Hello, good morning. I am Sarkot Karim, Consultant Transplant Surgeon. I will be very happy to meet you in the clinic.
Hi, my name is Chidambaram Nathan. I look forward to seeing you in my clinic.
My name is Badr Shrestha. I'm one of the consultant transplant surgeons working at the Northern General Hospital. It had been a great pleasure seeing transplant patients in the clinic.
Once you go on the transplant list, we have to know where you are 24 hours a day, 365 days a year. This is because we need to get you into hospital quickly because there is a limit to the period of time that we can keep the kidney. Some kidneys will come from the Sheffield region, but others will come from away, where they may have to travel many miles and are delivered by experienced paramedics to the transplant unit. If the kidney is coming from a long way away, we need you on the unit ready such that once the kidney arrives, we can send a specimen of your blood together with tissue that comes with the kidney across to the tissue typing laboratory for the cross-match to be carried out. The call for transplantation can come at any hour of the day or night, but I have to tell you, it most commonly comes in the early hours of the morning. The transplant coordinator will contact you by telephone and arrange for you to come into hospital. When you get this call, the transplant coordinator will explain the arrangements to you and will tell you that you must not have anything to eat or drink, because if the kidney is suitable for you, you will have to have a general anaesthetic for the operation.
Hello, this is Veronica speaking, Transplant Coordinator. I'm ringing because we've got a possible kidney transplant for you. Well, what we'd need you to do is not have anything to eat or drink until you get into hospital. Have you got someone with you? So, right, okay, what I need you to do is get some things together as if you're going to come in and stay overnight in the hospital. Are you fit and well at the moment? Okay. Now, when you come into hospital, you will have to have a blood test taken. And then there's a hurdle to cross when you get into hospital, and that is to see whether or not the kidney is a suitable cross-match for you. And so that takes a number of hours to complete. So it isn't a definite at this stage, but it is a suitable matched kidney for you. It'll be a few hours before we have those results, and when you come into hospital you will see the surgeon who will be carrying out the operation if it goes ahead. Transport, have you got someone who can bring you into hospital, or do you need some transport organising to bring you in? Okay, well, if you can organise yourself with your wife to actually get into hospital as soon as possible, within the hour if that's possible. Don't break any speed limits and make sure you're safe coming in. If you come to the Northern General Hospital, Vickers 2. Do you know Vickers 2? Okay. When you get to Vickers 2, the nurses will know that they know that you're coming in for this possible transplant, so they'll be expecting you, and they'll explain everything that happens from when you arrive. All right. Thank you. Thanks. Bye.
How will having a transplant help you? Well, first of all, it will get you off dialysis, and then it will get you off the fluid and diet restrictions that you are on and help you lead a normal life. There are some drawbacks, however. A transplant is not 100% successful, and therefore it may undergo rejection and have to be removed. However, the good news is that there is a 90% chance of having a successful transplant. Some transplants are lost after the first year, and the chances of having a successful transplant at the end of 5 years is approximately 80%. I cannot tell you for an individual patient how long a transplant will last, but many have had successful transplants over 15 years, some have had them more than 25 years, and the longest successful transplant here in Sheffield is 34 years old. There are over 5,000 patients in this country waiting for kidney transplants. However, it does not mean that you will have to wait until the other 5,000 have been transplanted. We need to find a kidney that matches you. It has to have the same blood group and what is known as the same tissue typing. Tissue typing is something that will be measured in your blood and constitutes a series of numbers that are measured on the cells circulating in your blood. Once we have measured your tissue typing, it is transmitted to a computer at the United Kingdom transplant offices, which are in Bristol. When a donor becomes available, the tissue type of the donor is measured, and that tissue type is fed into the same computer in Bristol. The computer automatically selects out the best match for that kidney. If I can explain it further, your tissue type is similar to a national lottery ticket. It has a series of numbers on it. And as you know, if on a Wednesday and a Saturday night the numbers on the coloured balls match the numbers on your lottery ticket, you would get a lot of money. If the numbers on a kidney donor's tissues match yours, then you would get a successful kidney transplant. You will, however, realise that people who do the national lottery often do not get any prize at all. That is because their numbers have never matched the numbers on the ticket. Kidney transplantation is something like this. Regrettably, it's something of a lottery. As there are 5,000 people waiting and only 1,700 kidneys available each year because of the shortage of donors, not everybody is fortunate to get a kidney transplant within a reasonable period of time. By a matter of sheer luck, some people may go on the transplant list on a Monday, and because a donor becomes available that has the same tissue type, they may get a kidney transplant within a week. Many have to wait several years, and in fact the average waiting time for a successful kidney transplant is approximately 2.5 years. If the cross-match is negative, then you will be prepared for theatre. You will go down to the operating theatre and the kidney transplant will take place. The operation takes about 2.5 to 3.5 hours, and your new kidney will be placed low down in your pelvis, just above your groin, on either the left or the right-hand side. There will be no need to remove your own kidneys at that operation. When you return from theatre, you will have several tubes in your body. You will have a drip in your arm, so that we give you an adequate amount of fluid. You will have a tube in your neck so that we can measure the pressure in your veins, so that we are giving you the right amount of fluid to make your kidney work. You will have a catheter in your bladder so that we can measure your urine output. And you will have a small tube coming out of your abdomen just alongside the scar of the kidney transplant, so that no bruising forms around your new kidney. All these tubes are removed within a week following the transplant operation. Regrettably, however, some kidneys undergo what is known as rejection. After a few days, your body will realize that there is a tissue in it that does not belong to it and may attempt to reject it. This is a natural response of the body, and these are called rejection episodes, and the majority of them can be treated quite easily by increasing your immunosuppressive drugs. However, in some cases the rejection may be so severe that the kidney is destroyed and has to be removed. The chances of this happening are 1 in 10. In other words, what I am telling you is that you have a 90% chance of having a successful kidney transplant. Immediately after the transplant, you will be put on drugs called immunosuppressant drugs. The purpose of these is to reduce your resistance so that you do not reject the kidney. The doses that you are put on at first are quite high, but once the kidney starts to settle in and work well, the doses are reduced. But you will need to remain on a small dose of these drugs for the rest of your life. If you were to stop them, the kidney would reject. Unfortunately, these drugs do have side effects. The majority of these side effects are very minor and involve such things as mild nausea, occasional vomiting, and diarrhea. However, 2 side effects of these drugs are quite major, and I need to explain these to you. The first is the risk of infection. Because these drugs reduce your immunity so that you don't reject the kidney, they also reduce your resistance to infection. And when you are on the high doses in the first few weeks to months after transplantation, if you get an infection, it may be quite severe. And in particular, a simple dose of flu may cause an illness lasting several days, and occasionally you have to come into hospital to have this treated. The other risk is the possibility of developing certain forms of cancer. The risk is extremely small, and I do not wish to alarm you, but you need to know about this. The commonest form of cancer to develop after you have been on immunosuppressive drugs for some time is skin cancer. This usually develops as small warty growths on the skin, is easily seen, and can be dealt with by a simple operation. The other very rare complication of transplantation is cancer of the lymph glands, and this again can be easily picked up and is amenable to treatment. How long will you be in hospital after the transplant? It is not possible to predict for the individual patient, but the average time spent in hospital is approximately 1 week. Following the transplant, you will begin to feel better, you will be established on a normal diet, and at the end of the week, many patients feel they are ready for going home. During the week that you are recovering from the transplant, you will be given another small booklet to read that explains the do's and don'ts when you get home. You will be required to study this book and be able to answer questions on what is in it before we discharge you from the hospital. Once you are at home, you will begin to feel better day by day, and most patients feel well at the end of 2 months, and many are ready to return to work at the end of 3 months. I hope this video, together with the booklet we have given you, has helped you to understand what having a kidney transplant is about.